content of this video is based on studies conducted in laboratories, and the effects described have not been demonstrated in human cancer patients. The scientific evidence discussed does not necessarily indicate the product's effectiveness. Who is HALAVEN injection for? HALAVEN is a prescription medicine used to treat adults with breast cancer that has spread to other parts of the body and who have already received other types of anti-cancer medicines after the cancer has spread. HALAVEN is also for adults with liposarcoma that cannot be treated with surgery or that has spread to other parts of the body and who have received treatment with a certain type of anti-cancer medicine. Important safety considerations. HALAVEN can cause serious side effects, including low white blood cell count and numbness, tingling, or pain in hands or feet. For more information, please see additional important safety information later in this video and full prescribing information available on this webpage. Microtubules are special tubes that give shape to the cell. They also play an important part in a process where cells split or divide. These special tubes are made with proteins called tubulin and can become longer by adding tubulin proteins to the tube's tip. Microtubules help divide or split a cell into two cells by acting like a string that can become long and short. This action of lengthening and shortening is crucial during a process when the cell divides or splits. Interrupting this action of microtubules blocks the ability of a cell to split or divide, causing the cell to die. In cancer, cells make copies of themselves in an uncontrolled manner. Treatments that can interrupt the lengthening and shortening of microtubules may prevent cancer cells from making copies. HALAVEN is a prescription medicine used to treat certain patients with advanced liposarcoma or breast cancer that has spread to other parts of the body and who have received at least 2 other chemotherapy treatments. HALAVEN works by attaching very strongly to special sites on the tips of microtubules and preventing them from growing longer. This keeps the microtubules from working normally and, as a result, permanently blocks the cell from dividing or splitting, causing the cancer cell to die. As a tumor grows, it doesn't get enough blood flow and oxygen, which means it needs more oxygen to continue to grow. This can cause new blood vessels to grow in a way that is not normal. And lead to changes that can encourage cancer to grow and spread to other parts of the body. This is because parts of the tumor with little oxygen create changes in the cancer cell behavior, making it more likely to move and spread to other parts of the body. The lack of oxygen found in the tumor is thought to be a key factor in tumor growth. So not only does HALAVEN block microtubules from working normally in cancer cells, in the laboratory setting, evidence shows that HALAVEN may cause changes in ways blood vessels grow. Which increases blood flow to parts of the tumor lacking oxygen. Laboratory evidence also suggests that HALAVEN may result in changes to cancer cells that affect how they move or spread within the body. The content of this video is based on studies conducted in laboratories, and the effects described have not been demonstrated in human cancer patients. The scientific evidence discussed does not necessarily indicate the product's effectiveness. In summary, microtubules are special tubes that give shape to the cell. They also play an important part in a process where cells split or divide. In cancer, cells make copies of themselves in an uncontrolled manner. Treatments that can interrupt the lengthening and shortening of microtubules may prevent cancer cells from making copies. Also in cancer, lack of oxygen found in tumors can encourage cancer to grow and spread to other parts of the body. Studies in laboratory settings showed that HALAVEN attaches very strongly to the tips of microtubules, keeps them from working normally, and as a result permanently blocks the cell from dividing or splitting, causing the cancer cell to die. In addition, HALAVEN may cause changes in the ways blood vessels grow, which increases blood flow to parts of the tumor lacking oxygen. Moreover, HALAVEN may result in changes to cancer cells that affect how they move or spread within the body. The following is important safety information about HALAVEN injection. What safety information do I need to know about HALAVEN? HALAVEN can cause serious side effects, including low white blood cell count. This can lead to serious infections that could lead to death. Your healthcare provider will check your blood cell counts. Call your healthcare provider right away if you develop fever, chills, cough, or burning or pain when you urinate, as any of these can be symptoms of infection. Numbness, tingling, or pain in your hands and feet. Peripheral neuropathy is common with HALAVEN and sometimes can be severe. Tell your healthcare provider if you have new or worsening symptoms of peripheral neuropathy. Your healthcare provider may delay or decrease your dose or stop treatment with HALAVEN if you have side effects. Before you receive HALAVEN, tell your healthcare provider about all of your medical conditions, including if you have liver or kidney problems, have heart problems, including a problem called congenital long QT syndrome, have low potassium or low magnesium in your blood, are pregnant or plan to become pregnant. HALAVEN can harm your unborn baby. Tell your healthcare provider right away if you become pregnant or think you are pregnant during treatment with HALAVEN. Females who are able to become pregnant should use an effective form of birth control during treatment with HALAVEN and for at least 2 weeks after the final dose of HALAVEN. And males should use an effective form of birth control when having sex with female partners who are able to become pregnant during treatment with HALAVEN and for 3.5 months after the final dose of HALAVEN. Are breastfeeding or plan to breastfeed. It is not known if HALAVEN passes into your breast milk. Do not breastfeed during treatment with HALAVEN and for 2 weeks after the final dose of HALAVEN. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of HALAVEN? HALAVEN can cause changes in your heartbeat, called QT prolongation. This can cause irregular heartbeats. Your healthcare provider may do heart monitoring or blood tests during your treatment with HALAVEN to check for heart problems. The most common side effects of HALAVEN in adults with breast cancer include low white blood cell count, low red blood cell count, weakness or tiredness, hair loss, nausea, and constipation. The most common side effects of HALAVEN in adults with liposarcoma include tiredness, nausea, hair loss, constipation, stomach pain, and fever. Your healthcare provider will do blood tests before and during treatment while you are taking HALAVEN. The most common changes to blood tests in adults with liposarcoma include low white blood cell count and decreased blood levels of potassium or calcium. For more information about HALAVEN, please see full prescribing information.